Today, I will be talking to you about law enforcement interactions with individuals who experience mental illness. This is my final for Psychology 1, and my name is Lily Cooper. So, the research question that we are going to be discussing today are how do factors such as mental illness impact citizens' views on police and law enforcement? Are police helping or harming, and are they being properly trained to handle interactions with individuals experiencing mental health challenges? So, what's the context? Daniel Prude was visiting his brother when he ran out of the house shirtless and shoeless in an erratic state. His brother proceeded to call the police, and authorities had received other calls regarding a naked man running in the streets shouting that he had coronavirus. When police had arrived, they described Prude as rambling and apparently delirious. This led to the police handcuffing Prude, who then proceeded to start spitting, which led to Prude having his face covered by a hood and pinned down face down on the floor. When Prude's head was being pushed face down into the pavement, he stopped breathing for 2 minutes. Even though medics did resuscitate Prude, he was pronounced dead a week later, a death that was never supposed to happen and a death that could have been avoided. Daniel Prude was having a mental health crisis. The involvement of law enforcement escalated stress and the entire situation at hand instead of calming the situation. Roughly 13 million people in the United States alone experience PTSD, and 2.7 million people in the US experience schizophrenia. Both of those mental illnesses can cause extreme stress when involved in police interactions. Stress that can lead to worsening not only the situation at hand, but the mental health crisis that the individual might be having. And in this case, for Daniel Prude, he was having a mental health crisis. And law enforcement made the situation 10 times worse and killed Daniel Prude for having a mental health crisis. So, we're going to be discussing my first article, which is perspectives of people with mental health problems at hotspots, attitudes and perception of safety, crime, and the police. So, what this article does, it examines how factors such as mental illness impact citizens' views on police and law enforcement through surveys from 449 street segments in Baltimore, Maryland. So, what this article and study did was they went around to, again, 449 street segments in Baltimore, and they studied hotspots. So, what they mean by hotspots are high crime areas and where there is a lot of police activity and law enforcement activity. And so they also canvassed and took surveys on places that did not have as much police activity, but the difference between those two areas were that the people with mental illness, primarily depression and PTSD, lived in those higher crime rates, rather than the people who lived in these lower crime rates were not experiencing those issues and didn't have the um those magnitude of interactions with police. And then in my second article, which is a potential new form of jail diversion and reconnection to mental health services, stakeholders' views on accessibility. So by stakeholders, we mean people with mental health, mental illnesses. So they looked at a method called the police mental health linkage system, which, in more summarized terms, they will be trained on whether or not this person is experiencing a mental health crisis. And in that case, they are connected with a mental health professional where they can calm the situation down rather than make the situation worse. And so this, in turn, is used to avoid arresting people with mental illness and connect those individuals with the correct mental health resources rather than throwing them in jail or death in Daniel Prude's case, and escalating a situation that can be de-escalated with the right mental health resources. So let's talk about data collections and methods. From our first article with the perspectives of people with mental health problems at hotspots, attitudes, and perception of safety, crime, and the police. The article studies this issue from a social science standpoint using abnormal and individual difference methods. Those methods are the surveys that they took with individuals who had self-reported mental illness. So the main variables of the study include perceptions of safety, which they measured with survey questions about how safe they felt in their neighborhood and rating feelings of safety in different contexts. Another main variable is the attitudes towards police, which they measured through surveys on perceived fairness, trust, and safety in regards to police and law enforcement in the area. And they did multiple questions like, how safe do you feel around police and law enforcement? How effective are police and law enforcement in your area? And do you feel safe in your area? Do you feel that law enforcement is doing their job and de escalating situations and helping with crime rates? And then on our second article, we have a potential new form of law, uh, a potential new form of jail diversion and reconnection to mental health services. Stakeholders' views on acceptability. So the article also studies this issue from a social science standpoint using abnormal and individual methods. So again, with the surveys, some of the main variables of the study are the acceptance of intervention, which were measured through focus groups with people who experience mental illness, where they were asked about their attitudes towards intervention. The second variable of this article were the people's concerns, which they measured in open-ended focus group discussions where they discussed specific concerns like being targeted by police enforcement. And they also talked about thematic coding to quantify concerns. What they did was they asked questions with people who experience mental health rather than going around and getting surveys from individual homes. And they organized group discussions with people who experience mental health and their interactions with law enforcement and their views on law enforcement. And they took these surveys and they took the questions and the answers and they coded it into the certain levels of concerns. Next are the findings. So let's discuss Article 1 findings. Researchers found that police with mental illness felt unsafe and had negative attitudes towards police. In conclusion, police and law enforcement needed to be informed on mental health strategies to appropriately deal with citizen interactions. This directly indicates that police are not properly trained to interact with people who experience mental illness. This lack of training creates a worse outcome for not only the individual with the mental illness, but the public in general. In Article 2, we found that there was support from both police and people with mental illness when it came to the intervention. However, there were still some concerns on the potential misuse. Um, Overall, the article concluded that the system was promising. However, there would need to be more research on it in order to implement that into the system. The article directly shows that police want to change the way they interact with people who experience mental illness. Everyone wants a safer environment, and in doing so, they came up with a method that both law enforcement and police agree with: mental health linkage system. And in our next slide, we see the limitations for both articles. Now, For both of the articles, we see that those are individual experiences and those are individual self-report surveys. And with self-report surveys, they segue into a bias and subjective interpretation, and it doesn't cover everyone as a whole. And for our second article, we see that the study focuses on a small group. So again, with the studies not seeing everyone with mental illness, all the different mental illnesses as a whole. So that creates a difficult time in understanding a more generalized public view. So let's answer our original question. How do factors such as mental illness impact citizens' views on police and law enforcement? Are police helping or harming? And are they properly trained to handle interactions with individuals experiencing mental health challenges? Citizens experiencing mental illness feel unsafe when it comes to law enforcement interactions, causing unnecessary stress on those individuals experiencing mental illness. This causes law enforcement interactions to harm individuals who are experiencing mental illness. All of this is due to the fact that police and law enforcement are not properly aided to handle interactions with individuals experiencing mental health challenges. So they're not properly trained. That's all it is. If they are properly trained and they are properly able to handle interactions where they can lower stress, they're able to de escalate the situation thoroughly rather than escalating the situation and leading to an unsafe environment for everyone. So let's talk solutions. In 2021, I wrote a bill that requires the use of crisis intervention training among all first responders in California, and that got passed into a law. Now, crisis intervention training is mandatory for all first responders in the state of California. It's also called CIT. CIT trains individuals to properly handle mental health crisis. So, in other words, it pretty much trains or it trains law enforcement to handle situations in a calm manner. And it's pretty much designated to de escalate the situation at hand. And that allows there to be a safer environment for not only the first responders, but above all, individuals experiencing mental illness. This is just the beginning of CIT. It's not mandatory across all states in the US. However, we can change that by implementing this law, allowing the US to create a safer environment for everyone. This is only mandatory for first responders in a handful of states in the US. That is an issue. So we need to be able to make a safer environment and a lot less stressful environment for people experiencing mental health issues. And that is all. Thank you for listening to my presentation. Have a wonderful day.